So we have some sensor that can be attached to the body that will help them to regulate their physiology and help them to calm down.
Hello everyone, we are currently at Wellness Center IIT Roorkee. Today we have Dr. Aditya Gupta, psychiatrist, and Mr. Athili, wellness counselor, joining us in the panel. So we just talked about seeing mental health as a taboo. Another thing which often goes around among people is myths regarding psychiatric medications. For example, a popular myth is that once someone starts a psychiatric medication, they need to do it for a lifetime, otherwise उनका वापस revert हो जाएगा to the situation. As a psychiatrist, how often do you find these cases in the treatment that you do to the patients? And could you elaborate more on these myths and how they hamper the well-being of a person in the treatment process?
Yes, surely there are several myths regarding the psychiatric medication, but these are myths, not the facts. So, going by the basics, if you see there are medications, there are some effects and there are some side effects. So, what we need, what we are intended to do with the medication is called the effect, and what is not intended is the side effect. So, every medication has a side effect as well as an effect. Okay, so it also goes with the psychiatric medications. But the myth is that there are several severe side effects with these medications, which is not true. Mostly the side effects are GI symptoms like nausea, vomiting, that two early symptoms that can be controlled within a days. Sometimes there could be a constipation or some other symptoms, but mostly these are benign. Okay, so these are not a major issue. Secondly, there are myths like if we start a psychiatric medication, then we have to take it for the lifetime. That is also not true. In several cases, we can stop the medication after some time. It should be taken for a long time, but it can be stopped. So it's not true that once you have started, then you have to take it for the lifetime. Then the third issue, the third myth is that it causes brain fog or it decreases your performance or your concentration, your memory is disturbed. This is also not true. It can in fact improve it, okay, because it is curing the brain illness, so it can improve it. It cannot deteriorate it, okay. Then another myth is that every psychiatric medication is a sleeping aid only, okay. So that is also not true. The sleeping medications are all different, and if they are needed, then they should be taken because sleep is very important for the health, okay. So every psychiatric medication is not a sleeping pill. In fact, there are medications which can cause sleeplessness also. So, okay, so it's also a myth. Then to summarize, we can say that the psychiatric medications are just like any other medication. There are side effects, but they are not much issue, and they can be controlled or they can be managed efficiently. You know? But these medications are necessary to improve or to cure your brain illnesses. That's why they are needed.
Also, sir, we have seen that facts usually does not reach people and these myths are easily reachable. So what does a person need to do कि वो इसके बारे में awareness पहुँचे उन तक and ये myths थोड़े कम होते जाएं. So what are the awareness campaigns that Wellness Center is running, or how can a person educate themselves with regard to this?
I personally think that internet is like a double-edged sword, you know. So avoid misleading sites. There are several motivational speakers and they misalign the medications. So avoid seeing them. Okay. Go to the correct sites. Like there is a site of Royal College of Psychiatrists, you know, Royal College of Psychiatrists of Australia and New Zealand, and there are Indian government websites, WHO websites, you know. So go to the true facts telling websites and just don't Google it, because it will also tell the facts and also the myths.
That was a very nice answer. I think our viewers will get to know, they'll get more education on this. We'll move to the next question.
We just talked about myths regarding psychiatric medications. लेकिन एक और myth है about the differentiation between ADHD and anxiety. A lot of people feel like both of them are kind of similar or more or less the same only. Because in normal world, you can say that both kind of make a person feel restless. So a lot of people have problem differentiating between ADHD and anxiety. So if you would throw a little light about how you can differentiate between the symptoms and how do they develop differently in ADHD and anxiety.
Thank you for the question. I think, like you said, it's very similar, the ADHD and anxiety. And I think one of the most striking similarity between ADHD and anxiety is both of these disorder make the persons feel restless and unable to concentrate. So sometimes there are confusion regarding these two. So if we go by ADHD, the main difference in ADHD and anxiety is that ADHD is a neurodevelopmental disorder and its onset is in childhood, whereas anxiety is a natural emotion that you experience when you face a stressful event. If that anxiety is happening constantly and you're experiencing frequently, so that can be problematic and it can create issue in your daily activities. So many students, I think, when sometimes they report attention and concentration problem is due to the fact that they are worried about their career, worried about their future, worried about things in life in general. So that makes them feel anxious, that makes them feel on the edge, as if something dreadful might happen. So they experience a lot of anxiety symptoms like palpitation, sweating, feeling fatigue, as well as irritability, and also they are not able to focus and not able to concentrate. So sometimes they mistook it as having ADHD. So which is very different. So again, in ADHD, it usually starts in childhood, and there are two types of ADHD. One is called the inattention subtype, and one is called the hyperactive subtype. So, and its cardinal symptoms or signs are inattentiveness, impulsivity, and hyperactivity. So I think that could be one way of differentiating. And sometimes both ADHD and anxiety can also co-occur together. So it's very important to consult the psychiatrist as well as the clinical psychologist for detailed assessment and evaluation.
Now we just talked about the differentiation between ADHD and anxiety. But one thing that is more or less seen in the younger generation is their casualness in relation to these diseases and disorders. They very normally say that I have ADHD, I have anxiety issues, I have depression, and one of the disorder that comes up most normally is OCD. A lot of people feel like it's cool enough to say that I have OCD. It makes them feel fit into the group. So how would you like to talk about it, about this the kind of misconception in the younger generation, and how does OCD actually develop in the real time?
It's kind of trendy to say I'm feeling like OCD, I'm OCD like people, but it's not like that. OCD is a disorder. It's a brain illness and it's not casual. Okay, so just being a perfectionist is not called OCD. Okay, you may like to put things in order or you like cleanliness. This doesn't mean that you are having a OCD. Okay, OCD means that having some symptoms like you can be over possessive with cleanliness, thoughts of contamination, or it could be like checking things regularly. You know that you have done the things right, but you have to check them. For example, you have been given an assignment, you know you have done it correctly, but you have to recheck it. Okay, then it could be imagery. Yeah, there are some images which run into your brain constantly and you can't control it. Okay, these could be in the form of thoughts called ruminations. There are continuously some film like thing is going on in your brain and you can't control it. Okay, so basically what is OCD? OCD is you can't put a brake on your thoughts or on your acts, that is compulsions. Okay, so it's OCD in simple language. It's caused because of some disturbances in some brain areas, that is why it occurred, which can be cured by medication as well as psychotherapy. There are several treatment options for it. But saying just if you want to put things in order, if you like cleanliness, then I have OCD, it's not like that.
I think this was quite a very good explanation as to what and the fine line between OCD and being a perfectionist, as because a lot of times people treat both of these words as being a synonym to each other, and that's how we should not do it. So thank you so much, sir.
We just talked about the details of ADHD and OCD and how to differentiate among them. Another thing that often goes around among students is that the cases of sudden outburst of emotions or the state of depression, so which is more technically known as mood disorders. So do you think that their lifestyle and environment around them plays an important role, since college students live in a very competitive environment? And what are the leading factors that may lead to mood disorders like bipolar disorder or persistent depressive disorder?
So basically, all of it depends on epigenetics. That is an interplay between the genetics and the environmental factors. So what happened if a person develops a mood disorder? Basically, his brain is already prone to it. Okay, so there are some genetic imprinting which are causing it, but it needs the environmental factor so that it can be unmasked and the symptoms appear. Okay, so it is like that a normal brain is maintaining an equilibrium. Okay, some some load came, and the error which is genetically imprinted is then unmasked, leading to the production of some faulty proteins which are then manifested in the form of some neurotransmitter disturbances and then finally into the symptoms. This is the technical description. Literally speaking, sometimes we say we are depressed. So the literal depression is a different thing. Okay, I have a fight with my friend. Yeah, I scored low. I can be literally depressed for a day or so. Okay, but if constantly my mood is low, I am feeling hopeless, I am having feeling of guilt. Everything in the world is just because of me. कहीं पे लड़ाई हो रही है, then it is because of me. Okay. Maximization, minimization, some cognitive errors are there, poor concentration, sleep disturbances could be there, then this is the clinical depression. Okay, at least for 2 weeks these symptoms persist, then it could be due to the clinical depression. Then you need to visit either the psychologist or a psychiatrist to get yourself examined, and then he can surely say that if it is a depression or not. Okay, so being literally depressed and having a clinical depression are two different things. Speaking about mood disorders, there are 3 or 4 types of mood disorders. It could be depression, it could be bipolar type 1, it could be bipolar type 2, or it could be mixed features. Okay, so sometimes there are mixed anxiety features also. So there are anxiety features and there is low mood. Both the symptoms are there. It is called mixed anxiety depression. So it could also be there. So what need to be done is we have to see the circumstance, in what context the symptoms are happening. Like, if the result has come and I have scored low, then I am feeling low, it's normal. Okay, but 10 days have passed and I am still feeling low, then it could be something else. Okay, and if there is no reason to feel low but I am still feeling low, then it could be depression, clinical depression, I mean. Okay, similarly, there is no need to cheer up and I'm feeling euphoric or elated. I am just spending so much and I'm feeling like I'm superior to everybody else, or I'm feeling that I am Superman. Okay, I am having powers, I can do everything. Then it could be the different thing, the different pole, that is the manic phase. And if there is a manic phase, then it is called bipolar disorder. Okay, so there is a difference between the literal word depression and the clinical depression, and soon the scientific association is doing about this, and they're going to change the name, but it's a long way for doing that. Till then we can differentiate by seeing the context, the severity, the duration, and if there is any doubt, then we can screen ourselves by doing a PHQ-9, which is available in every language, easily available online, and we can screen ourselves from it. Okay, if still we are having doubt, then we can consult the wellness center or the psychiatrist at the institute hospital. It's simple.
You really nicely covered the differentiation between the literal depression and the clinical depression, and also the genetic aspects of it. One of the things that I wanted to ask was that do you think that a traumatic episode in the past might resurface later in such mood disorders like bipolar disorder? Could a childhood trauma or a traumatic event in a past 2-3 years could resurface later in life?
Yes, certainly it can. But as I've said earlier, it depends upon both the factors. Okay. For example, in a certain family there is a death, okay? So 4 or 5 people all love the deceased person, but only one is getting the illness. Why? Everybody is concerned, everybody is feeling low. That's because the affected person's brain is prone to that illness. That's why that environmental factor has produced illness in him. So both the things are necessary. Okay, proneness could be more, so a little insult or little environmental factor can, or little trauma can produce the symptoms. And if the proneness is less, then the severe traumatic event can induce the symptoms. So both the things are needed.
So you just talked about in your answer about PHQ-9. Can you please talk a little about so that we can know more about it and as to how we can use it?
It is a self-rating scale, patient health questionnaire 9. So it is a 9-item questionnaire. Okay, you can just fill it. It's like a OMR sheet. You can fill it online. There are 2 ways you can score it yourself, or there are self-reporting tests available online. Okay, so it's available in every language from English, Hindi, Malayalam, Tamil, Telugu, etc. Okay, so you can fill it. Then if the score is equal to 10 or more than 10, then it's concerning. You could be having a depressive episode. Okay, and if it's less than 10, then it can be managed by the lifestyle. And if it's below 5, then it's all right.
Okay, so it's like a very normal way by which we can kind of have a hint if we are moving into the direction whether we might get such a disorder or not.
Just a screening tool. You can't diagnose by it. For diagnosis, you need the help of a psychologist or a psychiatrist, but at least you can screen it. You can say, oh, my score is more than 10, I need to consult. Okay.
All right. Thank you so much, sir. Now that we've talked about the mood disorders and differentiation in ADHD, anxiety, and so many things related to mental health, if a person or if a student in general is facing issues about not being able to express his emotions, just wanting to talk about it, so how can he be redirected to a psychiatrist in such a situation, and what are the steps or the protocol that Wellness Center of IIT Roorkee follows in this regard?
So if a student want to come and visit the wellness center, they can you do it in 2 ways. They can either call the landline number, or they can book the session through online portal. We have an online portal. You just have to Google IIT Roorkee Wellness Center, and if you open that, you go to appointment slot, and you can directly book it with your channel ID. Or you can either call the landline, or you can just walk in to have a session with a counselor. And sometimes, depending on the concern of the students, we decide whether counseling session or psychotherapy will be helpful, or whether psychiatric intervention and medication will be helpful. So the counselor will do detailed assessment and evaluation, and based on that, we direct the students in the appropriate channel. And I think one of the main thing that we do is that mental health exists in a continuum, that is well-being. There's a well-being range from healthy, mild, moderate, and severe. So all mental health problems, everybody experienced it. But if that mental health problems like anxiety and depression, if it's interfering in your daily activities, you're not able to go to class, it's finding it very difficult for you to do your daily course, and it's interfering in your social relationship, and it's basically creating a lot of difficulties in both your personal and professional life. And in that case, medication may be helpful. So depending on the student concern and need to basis, we direct the students to the psychiatrist.
Just want to add up, it's completely confidential. So you don't need to worry that my supervisor will know, my teacher will know, what would the friends call me, you are weak. It's not like that. It will be confidential. And you are not weak if you are seeking help. In fact, you are strong. That's why you are seeking the help. Okay. And you can directly come to the institute hospital and visit the psychiatrist. And if the therapy is needed, then you can be redirected to the wellness center as well. It's not necessary that if you have come to the psychiatrist, then you will be pushed, you will be forced to take the medications. It's not like that. Medication will be given only if it's needed. Okay, so it can be both way. You can come first to the wellness center, you can come first to the psychiatric hospital, institute hospital, to the psychiatrist. You will be given the treatment which is the best for you, whether medications are needed or whether therapy is needed. and it will be confidential. No one will be told unless the circumstances arises. Okay.
So we came to know that a wellness center at IIT Roorkee has a facility of brain gym, which is one only in all the IITs of India. So can you please tell us a little more about it?
Yes, so the brain gym, it have a biofeedback system where we attached some physiological sensor on the student's hands or on the student's head. So these sensors, for example, if a student is experiencing anxiety, so anxiety, like they have the palpitation, their heart is beating fast, their breathing is changing, and they're also experiencing muscle tension in the body. So we have some sensor that can be attached to the body that will help them to regulate their physiology and help them to calm down. And also we have a neurofeedback in which some electrodes are attached to the brain of the student, and these electrodes display the brain wave, and the student can use that brain wave to uptrain their attention and concentration. So when you are doing a neurofeedback session, the electrode is placed over your head, and then you see the brain wave, and you can actually consciously try to improve some certain brain wave like alpha wave. So the alpha helps you to be more focused, and also it helps you to be more relaxed. So you can use this facility to improve your attention concentration.
Thank you so much, sir, for this session. And coming up, we have Athili, sir. Along with him, we have Chitra ma'am, Ilika ma'am, and Ashfaq sir joining us in the panel. So stay tuned.